The Department of Health and Human Services, or HHS, is a massive entity, one of the largest federal agencies in the United States. It encompasses a wide range of services and programs that touch nearly every aspect of American life. It plays a crucial role in the lives of Americans from the youngest to the oldest, ensuring that essential health and social services are accessible to all. From ensuring access to health care to overseeing food and drug safety, its responsibilities are vast and varied. The HHS is involved in everything from medical research to public health initiatives, and from regulating pharmaceuticals to providing health insurance. Yet, this very size has become a liability. The sheer scale of the department means that it often struggles with coordination and efficiency. The HHS has become a sprawling bureaucracy, bogged down by its own complexity. The layers of administration and the multitude of programs can lead to confusion and delays. Its original mission, to enhance the well-being of all Americans, is often lost in a maze of regulations and red tape. The focus on compliance and paperwork can overshadow the actual delivery of services. This sprawling nature leads to inefficiencies that impact every aspect of its operations. The outdated systems and processes slow down the ability to respond to new challenges and opportunities. Funds are wasted, initiatives are delayed, and accountability is elusive. The lack of clear oversight and the complexity of the organization make it difficult to track progress and ensure that resources are used effectively. The result is a system struggling to keep pace with the evolving needs of a nation. As the demands on healthcare and social services grow, the HHS finds it increasingly challenging to adapt and innovate. It is time to acknowledge that the HHS in its current form is no longer serving the best interests of the American people. The calls for reform and change are growing louder and more urgent. We need a bold new approach, one that prioritizes efficiency, accountability, and results. By rethinking how we deliver these essential services, we can create a system that is more responsive and effective. This essay proposes a radical solution: dissolve the HHS and transfer its essential functions to more focused and effective agencies. By breaking down this giant bureaucracy, we can build a more agile and responsive system that truly serves the needs of the American people. Bureaucracy is often seen as the enemy of progress, and nowhere is this truer than within the HHS. Rules and regulations, while intended to ensure order and accountability, have instead created a system of paralysis. Every decision must navigate a labyrinthine approval process, stifling innovation and delaying crucial initiatives. This bureaucratic morass is not simply an inconvenience. It has real-world consequences. Consider the glacial pace of drug approvals. While patients wait for potentially life-saving treatments, the HHS's bureaucratic machinery grinds on, slowed by endless paperwork and redundant reviews. The costs of this inefficiency are staggering. Billions of taxpayer dollars are wasted each year on administrative overhead and poorly managed programs. This is money that could be better spent on direct healthcare services, research, or other initiatives that directly benefit the American people. Accountability is the cornerstone of good governance. Yet, within the HHS, accountability is often elusive. The agency's vast size and complex structure make it difficult to pinpoint responsibility when things go wrong. This lack of accountability is particularly troubling when it comes to the oversight of the pharmaceutical and food industries. Despite the best efforts of many dedicated individuals within the HHS, the agency's current structure simply does not provide the tools needed to effectively police these powerful industries. The result is a system where companies that prioritize profits over people often escape with little more than a slap on the wrist. This lack of accountability erodes public trust and, more importantly, puts lives at risk. It is time for a new approach, one that sends a clear message. Companies and individuals who knowingly produce harmful products will face severe consequences, including criminal prosecution. To restore accountability to health oversight, we propose a bold step: transfer the responsibility for enforcing drug safety and food safety laws to the Department of Justice, or DOJ. This move is not just a bureaucratic shift, it represents a fundamental change in how we prioritize public health and safety. The DOJ is uniquely equipped to handle criminal investigations and prosecutions. With its extensive resources and expertise, the DOJ can conduct thorough investigations and bring those who violate safety laws to justice. By transferring this authority to the DOJ, we send a clear message that endangering public health is a serious crime with serious consequences. This shift underscores our commitment to protecting consumers and holding wrongdoers accountable. This shift would have several benefits. It would streamline the enforcement process, making it more efficient and effective. First, it would deter companies from cutting corners or prioritizing profits over safety. Knowing that the DOJ is watching would make companies think twice before engaging in risky behavior. The threat of criminal prosecution is a powerful incentive for compliance. Companies would be more likely to adhere to safety regulations if they knew that violations could lead to serious legal consequences. Second, it would ensure that those responsible for harming consumers are held accountable for their actions. This accountability is crucial for maintaining public trust in our health and safety systems. This is not about punishing companies for honest mistakes. It is about creating a culture of responsibility and vigilance. It is about sending a clear message that negligence and malfeasance will not be tolerated. Companies must understand that they have a duty to protect their consumers. When companies know that they will be held accountable for their actions in a court of law, they are more likely to prioritize safety from the outset. This proactive approach can prevent harm before it occurs, ensuring a safer environment for everyone. A treasury of trust safeguarding social safety nets. Social Security, Medicare, and Medicaid are more than just government programs. They are lifelines for millions of Americans. These programs provide a safety net, ensuring that our most vulnerable citizens have access to healthcare and economic security. However, the current structure of these programs within the HHS is far from ideal. The Treasury Department, with its expertise in managing large-scale financial systems, is the logical home for these programs. Transferring them to the Treasury would streamline operations, reduce administrative costs, and enhance accountability. This move would also allow for a more integrated approach to social welfare policy. By bringing these programs under one roof, we can better coordinate benefits and services, ensuring that those in need receive the support they deserve. Charting a new course reimagining health and human services. Our proposal to dissolve the HHS is not about dismantling the social safety net or abandoning the government's role in protecting public health. On the contrary, it is about creating a more effective, efficient, and accountable system. By transferring essential functions to agencies better suited to the task, we can streamline government, reduce waste, and improve outcomes for all Americans. This is not a partisan issue. It is about good governance. It is time to move beyond the tired arguments of big government versus small government and focus on what truly matters: results. The American people deserve a government that works for them, a government that is efficient, effective, and accountable. Supporting those who serve, a commitment to HHS employees. This section is dedicated to acknowledging the hard work and dedication of the employees who have been the backbone of the HHS. We recognize that our proposal to dissolve the HHS will have a significant impact on the agency's employees. The uncertainty and concern that this change brings are understandable. These dedicated public servants have devoted their careers to serving the American people. Their commitment and hard work have been instrumental in delivering essential services and support to millions. We are committed to ensuring that they are treated with fairness and respect throughout this transition. Open communication and transparency will be our guiding principles during this period. Generous severance packages will be provided to all affected employees, providing them with financial security as they explore new opportunities. This financial support is crucial for their peace of mind. We will also invest heavily in retraining programs, equipping former HHS employees with the skills they need to succeed in the private sector or in other areas of government. These programs will be comprehensive and tailored to meet the diverse needs of our workforce. This is not just about fulfilling a moral obligation, it is about investing in our workforce. By providing these resources, we are ensuring that our employees can continue to grow and thrive. These individuals possess valuable skills and experience that can benefit our nation in many ways. Their expertise is a national asset that should not be overlooked. We are committed to helping them transition to new roles where they can continue to make a difference. Career counseling and job placement services will be available to support them every step of the way. A call for bold action. streamlining government for the people. The time for incremental change has passed. The challenges facing our nation demand bold action. Dissolving the HHS and transferring its essential functions to the DOJ and the Treasury Department is a radical proposal, but it is a necessary one. It is time to streamline government, reduce bureaucracy, and enhance accountability. This is not about making government smaller or bigger. It is about making it work better. It is about ensuring that taxpayer dollars are used wisely and that essential services are delivered efficiently and effectively. We urge our elected officials to embrace this proposal and to work together to implement it swiftly and effectively. The future of our nation's health and well-being depends on it. A healthier tomorrow. Embracing change for a stronger nation. Change is never easy, but it is often necessary for progress. By embracing bold reforms, we can create a healthier, more prosperous, and more secure future for all Americans. Dissolving the HHS is not an end in itself. It is a means to an end. It is about creating a system that is more responsive to the needs of the American people, a system that is worthy of their trust and their tax dollars. Let us embrace this challenge with courage and determination. Let us build a better tomorrow together. Thank you for watching. If you enjoyed this video, please subscribe, like, and share. Your support helps us create more content like this.